ADHD and addiction go hand in hand, like they're pretty much best friends. That's why I am super excited to be able to bring you this interview with Dr. Heather Brannon, an ADHD specialist. She's going to tell us all about the connection between ADHD and addiction, and she's going to weigh in on topics like medicating people that are in recovery with stimulants, which meds are helpful, which meds are not so helpful, and how ADHD impacts the recovery process. I think you're going to be pretty surprised by some of the things that she says. Now, one last confession before you meet Dr. Brannon. I forgot my good equipment on the day that I was going to interview Dr. Brannon. And so I had to do with what I had, which was my husband holding my cell phone. But the information is so good. I really wanted you to have it, so I went ahead and recorded it anyway. Is it my imagination? Or is there like a super strong correlation? Because a ton of our clients have ADD or ADHD.
Feel like because they made it through their day, they have to reward themselves. They need something to help them calm down because the day was so stressful and they were so overwhelmed. And so it's like, I got to the end of the day, I got to have a beer. Or I got to smoke a joint. So I see it a lot.
That's interesting because to me that connects a little bit to the willpower issue, because I usually tell people as you go through your day, you use up your willpower, and then by the end of the day, you know, it's like when you say, I'm going to get up at 5 a.m., I'm going to go work out. And you're good all day long, and you've resisted temptation, and you've worked hard. At the end of the day, your willpower supply is also gone. And I think for people with ADHD, that's like even more sort of exacerbated, I guess.
And the way that I knew that was an issue is because I kept having people, after I would treat them and their medicine was optimized, I kept having people come back saying, something's wrong. Like, I don't even think about drinking when I get home. What's up with that?
That's weird.
And it happens all the time.
So is what you're saying, Dr. Brannon, is that properly medicating ADHD can reduce your risk for addiction?
Oh, definitely.
Because a lot of people that we see have concern. A lot of the parents we see have concern if they medicate their child for ADHD early, does that set them up to have an increased chance for addiction?
No, a decreased chance. So especially those middle age, especially those middle school years, those are key. Those are important. Those are the times when we tell parents and kids, do not stop taking your medicine in the summertime, because those are the times when kids are starting to experiment and they're starting to do drugs. If they're taking their medicine regularly, then they're much less likely to even start doing that.
I'm really glad you said that, because I'm one of the people that say if you take ADHD medicine, take it all the time. Because we hear that a lot. And even people's doctor will tell them that. Like, don't take it when you're not in school or on the weekends or if you don't have a test, I've heard. And I disagree, because there's so many other symptoms of ADHD. The impulse control, the relationship problems, all those other things that happen all the days of the week and in the summer. Now, how often do you see people that you're treating for ADHD, how often do you see people abusing their meds?
So, this is, I was surprised. I was really surprised how often it doesn't happen. So I've been treating ADHD probably for 13, 14 years, and exclusively treating ADHD for the past 7 years. Okay. And I can count on one hand the number of patients I've had trouble with. So people who were taking their medicine when they weren't supposed to, they were taking more, they were getting it from other people. Most of the time, it's completely the opposite. Most of the time, they keep trying to decrease their medicine. I keep trying to tell them, you need to take more. And because these are perfectionists, and they don't want anybody thinking badly about them. They don't want me thinking badly about them. So they think that means they should take as little as possible. But
like, they don't want to look like they're drug seeking for one, because they have a self-consciousness about that. Right. And people with ADHD, a lot of times they don't like to take their medicine, especially young people.
Adults too. I can't tell you how many patients. I can't tell you how many patients I've had on their new patient appointment. They'll say not just, I don't really like taking medicine. They're adamant, Doc, I don't take medicine. I don't even take medicine for a headache. Because it means they're weak. They're perfectionists. So
like something about the ego gets in the way of that.
Right.
I think that's interesting that you say that you haven't had that many people abusing their medicines, because in the entire time I've been doing addiction counseling, I think I can count on one hand the amount of times that like a stimulant med, like an ADHD med, was the reason that someone come to see me, like addicted to stimulants. It's happened, but not very much. I don't include cocaine in that, but I do mean like amphetamines, basically.
So the interesting thing is, a lot of people, I get phone calls from parents, from spouses, from friends saying that their loved one is addicted. They're acting addicted, but it's really not addiction. It's the fact that they're taking something that works. So they think that the fact that they get upset if they're not taking their medicine, they think that's that's the definition of addiction.
Like that must mean a bad sign.
Right,
okay.
Because they're so dependent on it. But, we're talking about balancing brain chemicals, just like balancing chemicals if you're a postmenopausal woman and you need your estrogen balanced.
Right.
So if you're a postmenopausal woman and you're not taking your estrogen,
you're cranky.
Then you're going to have, you're cranky, and you're going to have hot flashes. So if you take your medicine, the hot flashes go away. It's the same kind of process going on.
Right.
So it's just because their medicine works and they need it doesn't mean they're addicted.
Right.
Addiction means
obsession,
right?
Compulsion, interfering with your life. Because I say all the time, there's a difference between being dependent on a medicine and being addicted to a medicine, and I think people get that confused sometimes.
The other thing is, actually all of my patients, once we find the dose that works, that's it. That's the dose that works. I don't have to keep going up and up and up on doses. If somebody's been on a dose for a long time and it's not going well, there's something else going on. It's not that the medicine suddenly stopped working. So it's, I have people I've been seeing for 12 years who are taking exactly the same dose of medicine that they took 12 years ago.
What do you think about people in recovery taking ADHD meds? Because that is something that comes up in our office all the time.
Yeah.
Do you have rules about that? Do you have professional opinions about that?
I have more opinions. I don't know about rules. Well, and I listen to you guys because you let us know when you think somebody is ready or not ready. But I think it makes things go much better. Balancing brain chemicals. We keep talking about it, but then also the fact that they can listen to their therapist.
I like that.
And they can see things clearly, and maybe they can look at their life more clearly, their past, and they're interested in conversations in a group setting. There are just so many different ways that helps.
That's a really good point, because I find that people that have ADHD that's not appropriately medicated, they don't do well in those longer therapy sessions. Like, they don't tolerate it, and they become really disruptive to the group. It affects their relationship. So for me, there are several reasons why, if you don't medicate someone in recovery who has severe ADHD, that you set them up for increased risk of relapse. Are there any times where you would not want to medicate someone for ADHD if they were in recovery?
If they're stable in recovery, I guess that's not really. There's like the subset of people who they're there, but are they really there, and are they really doing what they're supposed to? So with you guys, we know whether they're there or not. But with some other, if they're just seeing Joe Schmo therapists, for their recovery, I don't really know that they're.
Like, are they working a program?
Right. Are they
just saying I'm in recovery?
Right.
Okay.
And how successful is it? How's it going? I'm not getting any kind of feedback from anybody. So it's kind of someone who's relapsing and remitting. I'm taking my medicine, but I'm off over here taking all these other drugs, and maybe every third weekend I'm binging. That's not safe.
Sometimes I'm a little leery about if someone's drug of choice has been cocaine or methamphetamines. There's not really a black and white answer to some of those questions, but what you're saying is you're flexible and open-minded about the issue more than a lot of doctors.
Because it's going to help. I mean, it really is. It's if you're already starting out behind the 8 ball, then you need as much help as you can get, and if it's safe, then
right. So, do you think, as a whole, do you think ADHD is overdiagnosed or underdiagnosed?
I think it's way underdiagnosed.
You think it's underdiagnosed? Yeah. Okay. I think a lot of people will be surprised by that.
Oh, way under. Well, so if you recognize that 75% of adults who have anxiety actually have ADHD, then if you think about all the people you know who have anxiety, who feel overwhelmed, that overwhelm is ADHD.
How do you know the difference if you have anxiety that's really ADHD versus anxiety that's something else?
So the something else anxiety is usually a low serotonin level, so that's someone who worries about things that may or may not happen. Starving children in Africa, what happens if my house catches on fire, what happens if I drive off the road, what happens if I say the wrong thing in just the next second.
The what ifs, if they have the what ifs.
Right.
Okay.
But the other people are the ones who are just so stressed out because they can't get anything done.
I call it, it's a sensation of impatience. That's the way I describe it. Like, it's a constant feeling of pressurized versus worry. It's kind of like
the best options are going to be the longer acting, the longest acting. So I have lots and lots of patients on short acting Adderall, short acting Ritalin, short acting, but you get lots of ups and downs, and I think that down creates some cravings that they don't necessarily need. So something that's just much more steady is going to be much more physiologic and isn't going to feed into their cravings. Before Vyvanse was the best thing that we had, and it would last 8-ish hours if you're lucky. But now that we have Mydayis, the last 16 hours, it's amazing.
It's kind of like on cruise control rather than on a roller coaster. Feeling like really up here and really down.
It's kind of normal.
Right.